Excited to welcome Katherine Harrington, Executive Director for the Iowa Community Action Association, to the public health community, to IPHA's community specifically. I've gotten to know Katherine a bit over the past couple years through the Iowa Nonprofit Alliance. And as I learn more about community action agencies, and when I think about where the work of social drivers of health is going to take us, I see mission alignment um, between community action agencies and local departments of health, especially in the social justice space. I know there's a lot of local partnerships between the two, but I don't know if they are in all the places where they could be. And I also want folks who are at the state level in public health to see community action too, and to see Katherine and the association as collaborators in the fight against poverty to improve health outcomes. So that's why I'm excited to learn more. And I will turn it over to you now, Katherine.
Thanks. And of course, I lost my presentation as you were talking, so I'm trying to get it back here. Hold on just a sec.
Take your time.
I feel like you're seeing a kangaroo and not my presentation. Is that
Nope,
accurate?
we've got your slides are up.
Okay, great. Okay.
Yeah, you did it.
I
Although
didn't
now
know
I'm
if
interested in the
kangaroos up there,
kangaroo.
but a weird Microsoft background art. Well, thanks so much for that introduction, Deborah. Yeah, it's been a pleasure sort of finding the connection and sticky points between the Iowa Public Health Association and the Iowa Community Action Association. Similarly, we have statewide spread just like you all do. And so we'll get to our service areas in a moment, but I just like that we are in the same spaces and likely serving a lot of the same folks. And so we have been around for a long time as community action. We actually, our formation happened back in the 60s as part of the Economic Opportunity Act of 1964. And a lot of other programs really came to fruition during the same time as community action, like Head Start, Legal Aid, Vista, and a bunch of other sort of social mobility programs. This was really born out of the war on poverty that President Kennedy and then President Johnson and Sergeant Shriver really spearheaded during that time period. Um, Deborah and I were just talking about this before we sort of came on with you all, but poverty has turned into a little bit of a bad word, right? And so lately, with some of the audiences that we're finding ourselves in front of, economic mobility may be something that's a little bit more palatable. And that is truly what community action is all about. We are trying to ensure that I'll continue to use the word poverty in this group, but our mission is really about alleviating the causes and conditions of poverty and really ensuring that people have a pathway towards economic mobility and self-sufficiency. Um, and so that's what our purpose is. So today, so we started back in the 60s. Today, across the country, there are over 1,000 community action agencies. They're either private nonprofit organizations or public entities. Here in Iowa, we used to have one public entity here in Polk County, but probably about 15 years ago, they stopped being a public entity and turned into a private nonprofit organization. So in Iowa, all 16 community action agencies are private nonprofit 501c3 organizations. Um, Over the years of the 60 years of community action being alive, we've obviously gone through a variety of iterations. So in our original legislation, money went directly from the federal government to local agencies. In the meantime, it got transformed into a community services block grant. And so I'm sure many of you are familiar with how block grants work, but so now states get a chunk of money in those community services block grants, and then the states have the ability to then have some discretion on how those funds are distributed. But, at our core for community services block grant, it is, aimed at reducing poverty, assisting low-income families, in order to achieve that economic security. And so in that right, that is a really flexible source of funding for community action agencies, but that funding is also the funding that sort of is the grounding framework of how community action agencies function. And I'll get a little bit more into that in a minute. We're not going to go through this whole slide, but over the years, we have created a theory of change. So we're not just a bunch of rando nonprofits that are all trying to make life better for working families. We do truly come together around this theory of change, trying to leverage a variety of different funds in terms of executing against some of these services and strategies in support of families experiencing low income. And so we have core principles that we abide by. We also do a fair amount of performance management. So we have performance standards that we adhere to. We have something called a Roma cycle, which Debbie, you're gonna don't tell on me to the board, but Roma stands for something about a management. Oh, you got it.
Results oriented management and accountability.
There you go. And so this is really just a continuous process improvement cycle that agencies go through in order to ensure that we are delivering services in an effective and efficient way. Um, so the reason that we're unique, and like I mentioned, that foundational component of both the Economic Opportunity Act and the Community Services Block Grant, is that it is specifically targeted to revitalize communities, empowering families, and reducing poverty. There is no other legislation or other, sort of specific targeted money from the federal government that has that mission and intent. Um, and the reason why it is so important to the Community Action Network is because of its flexibility. We can really pinpoint those dollars in crisis situations if we need to, but it also allows us to leverage a lot of other funds. And so that's particularly useful as we are putting together braided funding across a variety of fronts. Um, so we have those 1,000 community action agencies around the country. We do have some infrastructure in order to help support us in our efforts, both nationally and regionally. And so we have a national association. Something similar to what public health does as well. We also have a lobbying entity called the National Community Action Foundation. And then because we partner so closely with our state agencies through that community services block grant, there's also an association that supports those state agency community action offices called NASCASP. And then, as Debbie mentioned, we've got these certifications for Roma trainers and implementers. So we're always doing professional development to ensure that continuous process improvement is always top of mind. Regionally, and I'm interested, do you all have regional cohorts where public health folks come together too, or is it really more state by state?
Yes, we've got HRSA
Okay.
region. We're Mink. Yeah.
Yeah, okay.
The
So
center.
similarly, we have a Region 7, so it includes Iowa, Missouri, Nebraska, and Kansas. And we work very closely with them on training and technical assistance activities. And really lean heavily on those group of professionals just to make sure we're providing the best training and technical assistance that we can. And so here in Iowa, the Community Action Association, our reason for being is really to help maximize agencies in their advocacy efforts. We provide a lot of training and technical assistance to agencies. And then we also run a few programs that I'm going to go through here in just a moment. But our state partners, these community services block grant dollars flow through at the state of Iowa, the Department of Health and Human Services. That's a newer change. We, up until what is it, 3 years ago now. Before state government reorganization happened, we were embedded in the Department of Human Rights and had been since our sort of formation. But with that change, we are now within the Department of Health and Human Services under the Community Services Division. And so we have 16 private nonprofit organizations across the state. As you can see, everyone sort of looks and feels a little bit different because they all do things a little bit differently. What the beauty of community action is that we are very community needs driven. And so what's happening at HACAP may not be the same kind of services that are happening at SkiCap, which is located in Southern Iowa, because those populations may be different. And based on some community needs assessment surveys that we do every 3 years, we really take that feedback and target services in order to meet those specific needs in our communities. So if you head to our website, please, we've got a nice interactive map, and you can click on the map and that will take you to the community action agency that serves your area. And there's contact information for each of those community action agencies. So we have collectively over 3,000 staff across the state. This is another thing that I love to talk about is because Community Action Agency really functions as the front door for a lot of people who are low income, who may be seeking services. We really have the opportunity to have really great partnerships with a wide variety of service providers in the service areas that we work in. And so we have over 6,200 like formal partnerships across the state, whether through MOUs or other arrangements where we can pick up the phone and have that be a warm referral. It's not just a handoff. We know who the other people are at the end of the line. And because of those deep relationships that we're making, we're successful in ensuring that families get the robust sort of wraparound services that they may need. Last year, we served just over 258,000 individuals across the state, which represents about 113,000 families. So, like I said, community action agencies, they're all a little bit different, but there are some common core programs that they all tend to administer. The one that you might know the most about or have maybe connected most closely with community action is the LIHEAP program, which is the Low Income Home Energy Assistance Program. Community action agencies do administer that and do that through, the money comes from the federal government to the state, but then community action agencies are taking LIHEAP applications and making payments to utilities on behalf of families that qualify. Another common program that is shared across community action agencies is the weatherization program. And this is where qualified families can get repairs done to their home to help it become more energy efficient. And so this is a really great way when paired with LIHEAP to help drive down the cost of energy in someone's home. All but 2 of our agencies across the state also host Head Start programs. And so there's a pretty significant early childhood education presence within our community action agencies. And gosh, I mean, these folks are just doing great things, making sure that our young kids are getting the supports that they need, but also that their parents are receiving the supports that they need in order to try and break that sometimes generational poverty cycle that happens. And so Head Start is just a wonderful example of how families can receive some wrap services that are going on as a result of that program. And then all but 3 agencies in the state also administer something called the Family and Development for Self-Sufficiency Program. This is funded through TANF and some FIP dollars, but it is a state-based program. And this is really intense sort of high touch case management program that families can enroll in, And we've had really amazing results with this program over the last 20 years. So we're very, sort of blessed to be able to have that contract in order to administer that program. Some other common programs that you might find within community action agencies are WIC clinics. Many of our agencies have either a food pantry, or HACAP is actually a food reservoir over in eastern Iowa. The CACFP program is a pretty common program that you can find. A couple of our agencies offer substance abuse treatment. And then some other agencies offer housing assistance as well. So as you can see, it's sort of wide and varied, and again, is very dependent on what's going on in the service area of each of those agencies around the state. So as the association, sometimes it is easier for funders to be able to contract with the association, and then we help distribute monies to our 16 member agencies. And so I'm just going to do a quick run through of some of the programs that IPHA actually runs, just to give you a sense of some of the other innovative things that are going on within the Community Action Network. So our first one is our CHAMP program. And so this, oh, sorry, my slides got out of order. I'm sorry. I will start with our Embrace Iowa program. So if you live in sort of Des Moines or the metro area, you might read some of the Embrace Iowa stories every year that appear in the Des Moines Register. This is a 40-long partnership that we've had with the Des Moines Register in order to talk about the impact of community action and really raise up the stories of people experiencing low income, and how Embrace Iowa can help in some of those regards. So all 16 agencies participate. Households can get up to a maximum of $750 per award. And you have to be, 200% of the federal poverty line in order to participate. Last year, we raised $416,000. So this is truly a grassroots fundraising effort where people are sending in everywhere from $2.50 to, thousands of dollars in order to support this effort. But we don't take any admin out of it. The agencies oftentimes utilize our CSBG flexible dollars to cover the admin, so that all of these dollars go directly to families in some of those awards that are being made. What's nice about Embrace Iowa is that these funds are very flexible. The board specifically designed it to help fill gaps that other funding sources can't cover. And so we made the decision that we can use these funds for things like fees and fines that are really preventing someone from potentially maybe reinstating their license, or something along those lines. It can help cover deposits and rent, medical bills, glasses that may not be covered by other programs. That's really a wonderful flexible funding source. Our next program are disaster services. So in 2013, we started administering the Iowa Individual Assistance Grant Program, and then in 2016 added the Iowa Disaster Case Advocacy Program. This had originally been with Health and Human Services, but last year moved over to Homeland Security as the state partner that we partner with on this. And this provides up to $7,000 of financial assistance to families who are at or below 200% of the federal poverty line who are living in a disaster declared county. So in order for this program to be turned on, the governor does have to declare a disaster in that county. And that, that sort of turns this on. But it's really a great resource. This is unique to Iowa. Very few other states have any sort of program like this, and it's really intended to, be in place in the event that not all disasters sort of raise to the level of a FEMA declared disaster, but they are still pretty significant events in our life. And so we're proud that Iowa is a leader in this area. And then disaster case advocacy is actually can be for any household in the county that has been declared in a disaster. So there is no income restriction on that support. And because community action agencies are so embedded in the communities that we serve, we really are a great resource for anyone who maybe has not had to navigate through social services programs or eligibility programs before. And so this is really a great service that we can offer to all disaster impacted Iowans. I think I just went through some of this eligibility stuff, so I'll go through that. And then we also have our WellPoint Champ program. I don't know if we've got any if you ever have any MCO folks step into this meeting, but this is a really innovative program that started as a pilot project and then just kept going. And so we work with 10 agencies that cover 16 counties. And this was really developed as an identified need by WellPoint to say, look, we've got some housing insecure folks in our network and who are using WellPoint services. What can we do to help stabilize them? As you know, this is clearly a social determinants of health issue. Let's figure something out. And so this is only for WellPoint members, but it allows up to $1,500 per member, not per household, but per member. So if you've got 3 WellPoint members within the household, that's $4,000 that you could potentially get, $4,500. And so most recently, we've had a grant for up to $765,000 and are able to help a lot of families who are involved in that program. And then this is one of my favorite. It's called the Diaper Distribution Grant, or Keeping Butts Dry is another way that I like to talk about it. Administration of Children and Families reached out a few years ago and really wanted to do a demonstration pilot. So this is, and in fact, research. And so they wanted to understand what the impact of having a concrete support for diapers and diapering supplies would mean for low-income families. And so Iowa had the opportunity to apply, and we applied with the construct that our existing home visiting programs like FADS, like our Hurley Head Start home visiting program, or McV, that those programs would be eligible to enroll families who have diapering age kids. So the nice part is that we're able to offer this service to anyone in the family who is of diapering age. So even if your kiddo isn't necessarily enrolled in McV, if you've got one kid who is and one kid who isn't, we can still cover the diapering supplies for that entire family. We just actually got a 4th extension of this grant, and so it's actually a 4-year grant. And I think we're up to a little over $2 million to distribute it. But we're finding that it is truly impactful for the families that get those concrete supports. And so we are at the end of our presentation. I sort of like to end with our promise, which is community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So, questions, comments, witty remarks?
We've got one question to kick us off in the chat from Lena. So question on LIHEAP. It is typically used for heating assistance, but my understanding is that it can also be used for cooling assistance. Is that happening in Iowa? If not, why? And is it something that we can advocate for? Is it a policy barrier?
It's not necessarily a policy barrier, but so LIHEAP actually has 2 different funding streams. It's for LIHEAP regular assistance, and then some of those dollars can actually be used for crisis as well. And so the crisis can be utilized in some cases for cooling assistance, but it's a much smaller pot of money than the regular LIHEAP assistance over the course of the, sort of heating period. of the year. So because we're deemed a cold weather state, we're not in Arizona, then that's where the majority
Is
of the
that the threshold?
well, I'm
We
not
have to
quite
have
sure
115
how a state
degrees.
gets deemed a hot weather state versus a cold weather state. That
Yeah.
is my pay grade, but Iowa is considered a cold weather state, and so only crisis funds can be utilized for some of that cooling support.
That's interesting. Okay, I'm processing that and thinking personally if I'd rather be hot or cold. I think both would kill me. Okay. I have some questions. Again, I have some questions for the audience writ large. There's a lot of local public health agency friends on here, and I'm so happy to see as many community action agency, hopefully new friends.